I'm the program lead of our critical trauma research group here. And we try to look at issues of gun violence and issues of violence and trauma that we see on the South Side. Gun violence tends to be the mechanism of injury around 15 or 25% of cases in different trauma centers. We actually reach around 40 to 50% of all of our traumas coming in affected by gun violence. And that's pretty unusual, especially it's very, very unusual in a place where there's no war going on, like no official war. That's something you might see during military deployments or something around the world. I had to operate on someone last night, and he had been shot previously and had multiple incisions and scars from being shot. And clearly the system has failed, like the healthcare system, the social system, the government in terms of protecting human rights. All of that has failed, because if he's still been harmed after being harmed the first time around, there's something wrong on a systems level. And then I know once he heals, I'm going to discharge him back into the same environment of harm that caused him to come to us in the first place. We have a robust violence recovery program with incredible violence recovery specialists. And we have a hospital-based violence intervention program. But it can only do so much if people are denied the ability to develop their full human potential and live with dignity the way other populations are able to do that in our societies. We're trying to get some trauma psychologists actually to not just help our trauma patients, which is very much needed, and to support the role of our violence recovery specialists, but we frankly need trauma psychologists for us as well. By definition, our work is causing trauma in us. It causes trauma in us. It's traumatizing. A lot of trauma centers now have some form of hospital-based violence intervention program. And the evidence is growing and is demonstrating that actually reduces trauma recidivism. It reduces the rate of people coming back with further injury. It connects patients to social programs and community level programs that are needed, not just for the patient themselves, but for their family members too. And also it's ongoing mental health support that these patients need. It's very, very hard for these patients. I mean, it's hard for me to find a trauma psychologist or psychiatrist, especially, if you don't have a diagnosis, like your insurance won't cover you. We want to connect people to care, to try to keep them as healthy as they can be, mentally. And if someone's just been through a very difficult situation, then that becomes even more pressing. They can't kind of be functional members of society if they're experiencing acute stress response or post-traumatic stress disorder, that type of thing. So we need to kind of treat them on multiple levels. So our violence recovery specialists in our violence recovery program is very helpful for that as well. People are mobilizing together, they're getting together, and there is so much more good out there. We only see the bad here in the trauma center, so we have to remind ourselves that there's so much solidarity out there. So that's what gives me hope, is seeing people fighting against that injustice and saying like, hey, we can have a more humane system for all.